I'm Scott Mabry, one of the joint replacement surgeons within the Department of Orthopedics here at UAB. So my specialty is hip and knee replacements and any kind of adult reconstruction pertaining to those two fields. Overall, I do mostly hip replacements, knee replacements, revision or redo hip replacements, redo knee replacements. Occasionally I do some preservation procedures around the hip and then occasionally some knee preservation procedures as well. So my approach to care really starts at that first clinical visit. At that visit, we will go over the symptoms that led patients into my office. We'll talk about x-rays, we'll look at those together. We'll start even from the early stages of treatment, whether that's non-surgical or surgical treatment, and work our way as far as the different options available to people. I think that kind of holistic approach and shared decision making is very important when talking about significant arthritis and then the care that's involved and eventually that joint replacement and the care involved afterwards. I think the most rewarding part of hip and knee replacement surgery is that change that you get to see in a patient's lives from the preoperative to the postoperative state. A lot of patients have dealt with severe debilitating pain from their joint arthritis for many years, and to be able to take an hour to 2 hour long surgery and have that significant and immediate impact where patients are able to walk again without pain, without assistive devices, and get back that life that they've missed, I think that's the most rewarding part of this job.